Welcome back, everyone. My name is Nikki Check, and in studio with me is Stephen Hopp with Rutland Medical Pharmacy. Thank you very
Absolutely.
much for coming.
Well, thank you for having me here.
So, we are here talking about your feature in the 2025 Faces of Kelowna. You are the face of pharmacy, and I really enjoyed the feature on you reading it. Um, so I have a number of questions, but I'm going to skip all of them. And I really want to go to the holistic health care. That seems so unique and different
hmm
um, from a traditional pharmacy. What does that mean?
I think sometimes, first of all, there can be a little misconception around the term holistic. Uh,
Mm.
Sometimes I think people look at the word holistic and they equate it more to uh, herbal, natural, that sort of thing. Really, when we talk about holistic, it just refers to all encompassing, so all aspects of it. But you're right. I mean, I think traditionally when people go to a pharmacy, they're just thinking of getting my drugs, my advice on medication and things related to that, maybe a bit of your over the counter. Whereas we really try to take approach of overall health, overall body, and we can do that because we're in an environment where we work so closely with physicians and primary care nurses. We really ensure that we use all the information that we have at our fingertips. So it's about access to overall patient information and the time. In my pharmacy, we make sure we have the time. We make sure we have the staff to have the time to spend more time talking to people, to find out their concerns, and if we can, address your overall global health concerns from physical, mental health, everything.
And reading your feature, it really resonated with me because and again, this isn't a broad stroke brush that is a statement of what all pharmacies are, but I find often when I'm filling a prescription, I might feel like I'm interrupting the counting, or I can tell like head down busy and I feel bad. I feel
hmm
bad. So what really jumped out to me in your feature was that you just said it again, you just validated it. You staff up so that you have the ability to take the time to talk to the individual. And again, I think individual. We are very individual. What works for me may not work for you. So, really taking the time to ask me questions and talk through things, I think is a great first step.
Yeah, absolutely. To me, it's all about the people, and healthcare shouldn't be cookie cutter. And sometimes it is that way, or it becomes that way. Uh, People feel rushed, as you said. You should never feel that way, and we certainly will never make people feel that way at Rutland Medical Pharmacy. We want to tailor the care that a person receives to that individual. We want to tailor it to what that individual's needs are. To me, everything is all about people. It's not about meeting numbers or business metrics or anything like that. If I believe if you take care of people, whether it's taking care of my team, whether it's taking care of the
Mm.
people that come through our door, if we take care of the people, we'll be successful and the people will be successful.
So, how are we so lucky to have you? How did you land in Kelowna?
um, I mean, that could be a long story. It was really a business opportunity. I've been in the Okanagan now for
Okay.
23 years. Had worked more in the South Okanagan.
Mm.
Had been an associate or an owner for Shoppers Drug Mart for years. For various reasons, ended up uh, ended up, going a different direction. And then a business opportunity came up here
I
in
love.
Rutland and when I looked at the pharmacy that was for sale, I just loved the environment, the unique environment where, I could be very clinical and work with the doctors. And I felt like I would really have the time to give our clients the care that they deserve.
I love that. And the universe has such an amazing way of presenting opportunities like
It
that. So,
does.
how long have you owned Rutland Pharmacy, medical pharmacy?
So I have had Rutland Medical Pharmacy now for nearly 4 years.
Okay.
Yeah,
Okay. Beautiful community, my
yeah,
favorite community, Rutland. So, let's, and again, correct me because I'm going on what I think. So I think a typical patient or client of a pharmacy, it tends to be geographically associated. So
usually.
will someone typically fill their prescription on their way home from said doctor or from the hospital? Um, what would encourage someone? So again, I think what I'm hearing is if you want to be heard, if you want to be seen, if you want to not be rushed, if you want to have the time to have all your questions answered,
Hmm.
everything in Kelowna is 10 minutes away. So
For the most part.
take it
Yeah,
take a drive
yeah,
to Rutland Pharmacy.
absolutely. You know, if if you're someone that just wants to fill a prescription and you're not interested in an interaction and extra care, that's great. You should go
Mhm.
where you want. If you're someone that wants time and wants to feel valued, and truly is valued by your pharmacy, then we're a place you should consider. And more of our people, of course, do live in the Rutland
Mhm.
area, but we have clients that come from the lakeshore area of Kelowna.
Okay.
Often maybe they happen to have a doctor in the clinic, or they used to live close by, and so they've had an experience with us, and then they now live farther away, but they go, you know what, I'm not going to get that experience or
Mm.
that level of care elsewhere, so I'm going to drive across town to come to you. And so I think it would be worthwhile. I mean, it's just a little bit of time for more people to give us a try and see if
Mhm.
what I'm saying to you, it truly is the experience you get, which I believe it will be.
Amazing. Are there any unique care programs or specialties that Rutland Medical Pharmacy practices in? I'm trying to think. Is there any type of care that is unique to the pharmacy?
I wouldn't say there's a specific type of care that's unique. Just what's unique about us is our people first attitude.
Mm,
And you might think, well, what is that really unique? Well, it truly is in
mm-hmm.
today's world.
Rush, rush, rush.
Yeah, I hear from so many people that, well, I get my prescription tomorrow or the next day or in hours, and it's never like that with us. And even though we're doing things quickly, we have more time for people. Uh, you know, I I've been blessed to do a lot of work and have a lot of interactions with some very wise people in my life. I've been on boards from the College of Pharmacists board to other things,
Mm,
and um, was able to learn a lot from some Indigenous elders. And there's a very wise man by the name of Solkson who always talks about being good medicine. I believe the Coast Salish word he uses is Islakin, if
oh,
I'm saying it right. But it means good medicine, and we all have an opportunity in our lives at all times to be good medicine. It doesn't necessarily mean pills,
yeah,
medicine. It means every interaction you have with with people out there. And so I
that's
try to take
beautiful.
that and apply it to my business, to my pharmacy, and to my level of care for people.
That's beautiful.
Yeah.
Stephen, you also reference a continuum of learning.
Mm-hmm.
How I think from what I'm reading, the breakthroughs in health and the innovations and the different types of treatments that are coming are fast and furious. So
Yeah.
how are you staying? I can't even imagine. Like the copious amounts of reading. I think I heard yesterday the amount of papers that are published every single day. You couldn't possibly read all those. But how do you focus on your continued learning and education and the team with you?
Yeah, you're right. It's not possible to read every new thing that
Mm-mm.
comes out. But as a pharmacist, as anyone in healthcare, you have a duty to keep up to date. Otherwise, you're not really serving your people. You're not serving your clients adequately. I mean, we're required by our regulatory college to do
Sure.
a certain amount of continuing education. But in addition to that, I think coming from an environment again where we make sure we have time for our clients, we also are able to have time in our day to
Mm,
do reading, and I try to ensure that there's enough coverage for my team, so my especially my pharmacist who works for me full time has opportunities to do reading and education during the day when needed. I also work really closely with the university, with UBC. We get
mm.
regularly students through our pharmacy, and so there's a lot of learning that you can take
I
from the students.
love.
They're always the most up to date. I often tell pharmacy customers when I have a student, hey, you should talk to the student. They probably are more up to date and know more than me. I'm the old guy. But so those students bring a lot of great information into us that so we can ensure we're up to date through them as well.
Beautiful transfer of new knowledge and sharing would happen through
Absolutely.
that. That's amazing. Is there anything else you'd like to share with us?
Oh wow. I mean, there's always so much. I think that pharmacists can do more than we
Mm.
used to be able to. It's been,
Mm.
I think it's coming up on a year roughly now since pharmacists have been able to do more prescribing. So pharmacists, without a person seeing a doctor, can prescribe for minor bladder infections and shingles pain and minor ear infections, a lot of skin-related things, birth control and contraception. So you don't need to see the doctor for these. There's a list of what they refer to as 21 minor ailments. But again, we have the time. So if you are having a problem with access to care and you have one of these many medical problems going on, you can come
That
straight
fall
to us
under
at
that.
Rutland Medical Pharmacy. We'll do a consultation with you. So it kind of is like going to a walk-in clinic. It's not just giving the person the medication. We do a consultation and assess the person like a
Mm.
doctor would or a nurse practitioner would to see, is this appropriate? What should we or shouldn't we give? Um, but as pharmacists, we're there. There's not going to be much wait time, if any. We're always accessible, and we're some of the most accessible healthcare workers out there.
And so now I'm probably putting you on the spot,
It's
and
okay.
please decline my question if you like. So if we look at, and that was a great can of worms, and I'm going to try not to crack it open. I do get frustrated in our wait times,
Hmm.
in our clinics and our accessibility, because it is very challenging to
Yeah,
see a
it
doctor.
is.
Even if you have a family doctor, it's challenging to see a doctor. So do you think, so here's my positive, um, in the period that pharmacists have been able to prescribe
Hmm.
for those certain conditions, I think that was sort of the test pancake, if I can call it that.
Sure.
I think it's worked really well.
Hmm.
Do you think there will be an ability to continue to add conditions?
I believe so. I mean, I'm not quite as in the know now because I'm not on the board of the College of
Mm,
Pharmacists anymore. But when I was on the board, certainly we'd sometimes have people from um, the provincial government, from the health ministry, that would report to us on how certain initiatives have been going. And of course, the college has to put the legislation in place to make sure it's safe for the public. So there's
absolutely.
a lot of discussion there, but there has definitely been feedback directly from our government saying they feel that it's gone well, that pharmacists are making a difference with what they're doing so far. And the whole goal with our government putting this program in or expanding the scope of practice is that they wanted to provide better access to care because they know there's challenges like what you're saying. So if they're saying they like what they're seeing, I think they're more likely to also add to it.
And Stephen, I can tell you firsthand, your comment on the prescribing for shingles.
Mhm.
I had a little rash. I go downstairs and I'm like, can you give me like calamine lotion or something? I got something that's itching me. And the pharmacist downstairs said, Nikki, do you mind if I take a look? And I'm like, yeah, sure. I lift my, and it's a little patch about, about that big. And he's like, oh yeah, that's shingles. And we're
Yeah.
going to need to, but I just want to sort of unpack that. And this, had I gone back upstairs, right? Had they not
Hmm.
been able to prescribe, had I gone back upstairs, phoned my doctor, week and a half before I would have been able to get in to see my doctor. So this was like at the beginning, I was able
Yeah.
to get a round of whatever, whatever the prescription
Sure.
was. And like literally was like better so
Yeah.
fast. It was the treatment, early detection, early prescription treatment really helped me not suffer.
Absolutely. And there's so many things where early and timely treatment, that's a perfect example for a UTI, a bladder infection, another perfect
Yeah.
example. So these are things that is determined a pharmacist can safely do, that doesn't require, as the greater assessment that a doctor would do in terms of physical examinations. I mean, a pharmacist can do a little bit of physical
Yeah,
assessment,
yeah,
like what you
yeah.
described, but not as much. But
No,
that's okay. That's why specific ailments have been put out
makes
here
such
that
sense.
that's determined are safe, that are within a pharmacist's knowledge and expertise, and hopefully our doctors can spend their time addressing more serious things that they have the expertise to deal with that we probably don't.
It makes such sense.
Mm.
It looks like a really good program.
Mm.
So for everyone out there, if you want to have more conversation around your prescriptions, if you want to not feel rushed, please head on over to Rutland Medical Pharmacy.
We would love that. We would love to see anybody new.
Thank you very much for coming in.
Okay, thank you very
Thanks,
much for
Stephen.
having me.